Good morning, everybody. This is Dr. Jeff Culbert. We are finally bringing you an adjustment video. We just concluded an interview with one of our patients by the name of Josh, and we're going to go through getting him adjusted. So Josh, say hello to everybody this morning.
Good morning.
Okay, let's have you lay down, and we're going to get started. Just so you know, Josh does an extreme amount of traveling, so it's not uncommon for him to be gone a week or two. And when he comes in, he's generally pretty, for lack of a better word, jacked up. Okay. So he's just got back from a trip into New York City where he's been all week. So we're going to get him adjusted and we're getting ready to rock and roll for another week of busy work. So again, as we come in, as we do with most patients, we're always going to look at somebody's leg lengths. And we notice that Josh's left leg is definitely shorter than his right. So we're going to start and hold here. And again, for everybody who's new to the channel, we do use a technique called applied kinesiology. And applied kinesiology is the gentle art of muscle testing so that we can see what's going on with somebody. Just as you have facilitatory reflexes, like if I hit his tendon, that leg is going to jerk. Inhibitory reflexes via Golgi tendon organs are going to have his arm weaken. So I know exactly where to adjust, when to adjust. But most importantly, also, it's important for people to realize chiropractors also have to know when and where and when not to adjust somebody. Because if something's starting to lock in and hold into place, we certainly don't want to be over adjusting it, but we do want to make sure we're adjusting the appropriate segments of the spine so that he is getting the biggest bang for the buck where things are healing. And when they start to lock in, we allow those ligament structures and the muscles around those joints to do their thing so the body can adapt to the stresses that are being applied to him, as it should be in the course of nature. So with that left short leg, we have found that his sacroiliac joint's a little bit off. We're going to get the blocks underneath to start to balance the pelvis. We use 6 different techniques in the practice. Some of them are a little bit on the gentler side, and some of them are a little bit more on the aggressive side. Blocking, the use of the activator, the flexion distraction, generally all considered gentler forms of adjusting somebody. With each and every individual patient, we try to find what is, if you're looking at Goldilocks and the 3 bears, what is just right for them. So everybody will get adjusted somewhat a little bit differently within the office. We'll use some acupressure points, such as for the adrenal glands in terms of what we're doing here. There's a little bit of a thyroid point we're going to need to take care of. We'll manually adjust the spine, use the activator, the flexion distraction. We do some SOT in the practice, extremity adjusting. So there's a lot that goes on when you're here in the practice in a rather short period of time. And then after we do a little stimulation on some of the acupuncture points for 30 to 60 seconds, we'll go back and double check, make sure the body's accepted that input. And then we'll move on. In the meantime, how was the trip? Work in the city, all was good?
It was good.
Good.
Okay.
Long days, right?
Yeah, long days.
Now you, my friend, I need you to relax a little bit. I can already feel some of the tension. Yeah, you're going to smile. You're going to, there we go. That was beautiful. And again, you're going to relax for me. Smile. There we go. If you're wondering out there in YouTube land why we ask people to smile, it helps them to relax. People are generally going to be either tense or relaxed. If I don't get you to smile, laugh, or giggle, you stay tense. And if you stay tense and I try to bull my way through an adjustment, you're going to end up hurting the patient or aggravating or making the muscle overstretch and have a rebound tenderness afterwards to it. If we can get a patient to relax just as Josh did by smiling, adjustment goes generally very, very easy. Go. And we're just doing a little pressure over the muscle, a little tension there to get it to try to just melt and relax like your finger on butter. And Josh will probably tell you that right about now, that's probably what he's feeling with that muscle starting to go. Mm-hmm. We're going to work the other side of the trap. Now, the techniques that we utilize and the approach that we take with most patients If you've seen other YouTube videos, you're probably wondering, is Dr. Jeff's office seems a whole lot different than most chiropractic office? And we try to design it that way. We want to be different. We don't want to be the same as everybody else out there. And part of that goes along with my contrarian nature, right, Josh? Okay, so you're going to hold your arm up again for me, Josh. Okay, the adrenal points look really good right now. The thyroid point looks better. Great. Cervical spine's engaged. And with everything else we did, I didn't forget I have to go down and take care of the knee. You can relax that arm down for a second, Josh. And again, just utilizing the activator along the medial meniscus, the lateral meniscus, the cuboid, and the talus. And it's nice that he wore nice loose shoes so I don't have to pull them off to get to the spots that I need to do. Go back and double check. Excellent. We've got an L4. We got an L3. Excellent. Okay, so we're going to take the blocks away from Josh now. And Josh, I'm going to ask you to lay on your side for me, please. There we go. And you're just going to relax that shoulder back for me, Josh. There you go. And face the other side, bottom leg straight. Now, you got to let these arms relax back a little bit. Shoulders back all the way and relax. There you go. Thank you. Turn on your stomach. Now, as we look at Josh's leg lengths, you'll notice that the position 1 leg length is evened out. You just bring him up to position 2. He shortens up a little bit. So again, to do that, we're just going to take the activator, going to give a light input at L5, S1 joints, traction out that lower back with a little flexion distraction. I'll work it out a little bit by engaging. Again, a little pressure over the muscle, get this to relax a little bit. And we just hold until we start to feel the muscle start to relax and give. We're going to get T12. That inferior C5 can be related to thyroid, and get a little stretch. Josh, how'd that adjustment go today? Excellent.